Good evening. This is Paul Black again. I am just wanting to give an update on my situation with prostate cancer. I posted a video back several months ago where I had learned that I was diagnosed with prostate cancer, and I had the prostate removed on May 5th, and so it's been kind of a process since then. And one of the things, there was a concern that not only the prostate was very involved with prostate cancer, but the cancer had also leaked out into the area nearby the prostate, but got into some of the lymph nodes. I had 5 of 26 lymph nodes that had small cancer tumors growing in them. So the concern was that it's possible once it's in the lymph system, it could possibly have spread to many other places in my body. And the interesting thing is even though the prostate is removed, the reason I found the prostate cancer was due to a PSA test, which is a prostate-specific antigen. It's a blood test, and that's why I found out in the first place that I had the cancer. I did not feel ill in any way. I was, so it was just a matter of the PSA was rising, and that's why I had a biopsy done. Actually, I'd had one done 2 years prior that came back clean, and so nothing was done. But here, this year, the beginning of the year, the PSA was rising, was more than double what it was 2 years ago, so there was a concern again. And so it turned out that the biopsy showed the prostate was very involved with prostate cancer. And so following the surgery, the pathology report showed that there were 5 lymph nodes that were infected with tumors, as well as the prostate. So I just recently, it's actually 3 or 4 weeks ago now, that I'd had the PSA checked again, which that's standard following prostate removal, because if the cancer from the prostate spread elsewhere in the body, the cancer tumors would be the same type as what was in the prostate, so they will give off this PSA, or prostate specific antigen. So I'm very grateful to say that my test at the clinic here in Hibbing came back with a 0.01, which my personal doctor here in Hibbing said that was the lowest she had ever seen in my situation. And she spoke from experience, because she had worked in oncology, with cancer treatment prior to coming to the clinic here in Hibbing. So when she said that it was lower than she'd ever seen, I thought, wow, that's really a good sign that things are in good shape. And then the following week, I had my checkup down at the Mayo, a post-surgery checkup, where there again, they did a PSA test, and the PSA came back below 0.1. And at the Mayo, they don't assign a number lower than 0.1, other than if it's below 0.1, they consider the PSA to be undetectable. So there again, it just confirmed what I found out here in Hibbing. And but in saying that, I still want everybody to keep praying. My local doctor, being she had worked with cancer in the past, the doctor she worked with said that even though you don't see mice, they could be in the walls. So there's that remote chance that there could be something out there that we're not seeing in the PSA. So I want you to continue to pray for me, agree with me for healing. I believe that that's God's plan. And down at the Mayo, the physician's assistant that I met with down there more or less said the same thing, that I was taking a hormone blocker, which I'm not taking, being the PSA was so low now. I asked if it was okay not to take that, and they said it was all right not to take it, so that would hinder cancer from growing. And it is possible that the physician's assistant said that it could be that the Lupron was holding back cancer, so now 3 months from now we'll check that PSA again. And so I'm just trusting God that even another 3 months, I'm just trusting God that PSA is going to be undetectable once again. And so just agree in prayer for that for me. And also, I just want to point out, I think there are three significant things that I did in dealing with this cancer. Was one, I paid attention to the PSA. There's a lot of things on the internet that downplay the value of PSA tests. If it were not for the PSA test, I would not have known I had cancer, and chances are my cancer would have spread where it would not have been confined to the prostate in the immediate area if I had not paid attention to that PSA test and had a biopsy done. It probably wouldn't be as good of a prognosis as what I have. So I just encourage you, if you're a guy and you're over 50, it's a good idea to get a PSA test, because especially if you're in that age. I'm just 60 years old. My doctor said that especially at my age, if you have prostate cancer, it tends to be the aggressive type that can really grow fast. And in my case, it certainly did. So going to the Mayo Clinic, I had the surgery done robotically. They do like 1,000 of them a year down there. So finding a physician that does a lot of this type of surgery, you tend to have better results. And that's a good part of the reason I went down there. And I think they did a good job for me down there. And the second thing is, I have significantly changed my diet. I've tried to eliminate sugar, the white stuff, the poison that tastes so good, because it not only helps cancer grow, and it hurts your body in a lot of ways, even though it tastes good. So I'm really trying to avoid sugar the best I can. And part of the reason I started doing that is if there was cancer growing out there, that would feed it. That would cause it to grow more. So I was just extra cautious over the last few months. And another thing that I have been doing is I've been using something called Prostate. It's a non-toxic alternative treatment that's used for cancer. It's actually good in treating a lot of different diseases. People have had success in a lot of different types of cancers, as well as intestinal problems like Crohn's and just all kinds of things. And it says it helps with autoimmune diseases, which I'm diabetic, so I thought, well, maybe it'll help with that too. And I think between eliminating sugar and using the Prostate, I think the combination of things, I think it's probably some of each that's helped my numbers with my kidneys, my liver, my blood sugars. Everything is much, much better. So I'll do a little bit more information on Prostate in another video, because it's something I think is significant. I think it's something that's worth looking into, especially if you are diagnosed with cancer and the doctors are unable to do anything for you. people have had remarkable success by using Protocell. So that's all for now, and just I would appreciate your prayers. I want to thank everybody in my church, Open Door Church in Hibbing. I know I've been on the prayer chain there, and my daughter's church, the Life Church down in the Twin Cities area in Eden Prairie, praying for me down there, and just all around the world. Philippines, our Fire of Life Ministries, brothers and sisters. I know there's been a lot of prayer from over there. So I just want to thank everybody for praying, and please continue to pray. I just believe God is continuing to heal and keeping me healthy. So thanks.